Do you cringe at the idea of explaining interproximal reduction to your patients? In this video, I'm going to show you how to confidently discuss IPR during aligner treatment so you can speak with ease and clarity. Hey, I'm Dr. Avi. I'm a dentist who started over 50 cases my first 6 months of offering aligners, and I've gone on to do hundreds of cases since. I've used IPR to solve crowding cases just like this and have easily discussed how the procedure works and what to expect with my patients so that they feel at ease during the treatment. But it wasn't always like this. You see, when I first started out doing aligners, I was terrified of talking about IPR to my patients because I didn't know how to explain it to them without making it sound like a form of torture. And so over the years, I've come up with what I call the IPR talk track. And it consists of 3 things: struggle points, phrases to avoid, and 6 power phrases. And I'm going to share all of these with you today. So let's get into it. Now, like with everything, remember this training works for all clear aligner brands. So take the concepts and apply them. That's the only thing that matters. So what is IPR? It is a technique that usually involves some type of rough disc or strip that you move between the teeth to remove the friction and create space for teeth to aid in tooth movement during orthodontics. If you want a bigger breakdown of this procedure, go and watch this video right here. I break it down step by step and give you 5 strategies that you can use to do IPR effectively. So why are dentists afraid of talking about IPR? First of all, there's a lack of education. They don't know how to do it. They were never taught how to do it. Dental school does not cover the concepts of aligners, let alone IPR. They also don't have a predictable or reliable way to do it, right? There's a bunch of techniques out there. Some are better than others, but there isn't something that they've actually come across that is reliable, that they can count on every single time and for every single patient. Yeah, so dentists don't feel comfortable with this idea of removing healthy tooth structure. And it's kind of ironic because they will easily go and just shave down a tooth to do a crown, but if they got to remove 0.5 millimeters from a tooth, they are freaking out. But I totally get it because at the end of the day, it is new and it's different and it's scary. So for me, when I first started out, I remember I had a patient, we were doing IPR for the first time, and I didn't necessarily tell her everything that we were going to do. And so we sat down and she saw the disc that we were going to use, and she looked at me and she's like, "What is that?" And I panicked and I freaked out. I'm like, "Oh, we're just going to kind of like shave between the teeth and just make some space." And she freaked out. She started bawling in the chair, and I had my mask on and my loops on, and I was like, I wasn't crying, but I was sweating. I was super nervous the whole time. I'm pretty sure my hands were shaking, so not a good look, very traumatic. We did 0.3 millimeters. It wasn't even a lot, but it probably took 3 times as long because I was so nervous and I wasn't confident in my ability to do this. And so you've probably been in a position like this before, or this might be something that you're afraid of experiencing. And if you are, just know you will be okay. If you watch the rest of this training and you go watch some of my other ones, you will have the confidence that you need to actually talk about and do IPR. And so if you want a surefire way to scare the crap out of your patients before you do IPR on them, use one of the following phrases. But before I give you the phrases, let's just take a step back and talk about why are dentists so bad at communication? One of the reasons is they never had training on it. They don't teach you how to talk to patients in dental school. They don't really teach you much of anything in dental school, but that's another topic and story. But the thing is a lot of dentists, it's all science and clinical backgrounds. It's not actually communication. And most dentists, we think that everybody else knows and cares about teeth just as much as we do. But newsflash, they don't. A lot of people don't care. They don't really want to know everything. They don't want to know the technical jargon or the terms. They just want to feel safe and comfortable and have a general idea of what's happening. And then you have some patients who don't even care. And they're just like, do what you need to do and get me out of here. So this is why dentists struggle with communication, because sometimes they tend to over-explain and they think that's what gives reassurance to the patients when in fact it's the exact opposite. So how important is it to use the right words when talking about IPR with patients? The thing is patients are going to sense your confidence, right? They sense your feelings, they sense your confidence. Just like the patient who I had where I was trying to do IPR on them and I was freaking out, she probably freaked out even more because she knew I was freaking out. And so if you're scared, they're scared, right? But certain words that you are using have negative and scary connotations. Words like shaving, okay? Nobody wants their teeth to be shaved down. That sounds horrific. And so you have to use words that apply to what you're doing, but try to use them in a positive light. And so the common phrases that I I've seen dentists use are the following, and you need to avoid these: shaving, stripping, grinding, drilling or chopping, slenderizing. Dentists think they're so cool when they use the, oh, we're just gonna slenderize the teeth. Like, nobody wants to be slenderized, especially with their teeth. And then IPRing. Don't use these at all. So if you're using them, stop. I'm gonna share some phrases that you can use, but if you're using any of these, don't do it. Now, if you're a dentist who wants to get confidence with aligners and you just don't know where to start, be sure to check out one of my free trainings. But if you want something that's more structured with implementation, resources, and support, you might be a good fit for our course, Aligner Blueprint. It's helped hundreds of dentists generate over $9 million from aligners alone. And the link for all those are in the description below, or you can just go to our website, clearalineradvisor.co, and everything that you need is there. So here's 6 power phrases that you need to use when discussing IPR with your patients so that they feel comfortable with the procedure. And the 6 phrases to use when discussing IPR. The first one, flossing with a smoothing device. Okay, so this phrase compares the IPR process to something that patients are familiar with. Flossing, right? But it adds the clarification that it's with a special tool. And so you're making the process seem routine, yet professional. Another one that you can use is quick or minimal. This is gonna be a quick or minimal procedure. So these words emphasize that the procedure itself is fast, it's minimal, and it makes it seem like it's small and it's not that big deal, but it's also manageable in the aligner process. The third phrase that you can use is unnoticeable. Hey, we're gonna do this, it's gonna be unnoticeable. And this refers to how the process itself is not gonna have a visible impact on the appearance of the teeth. And so this just reassures your patient that nothing is gonna change cosmetically, because it's true, except for the fact that their teeth are gonna be straighter. Hey, real quick, if you're enjoying this video or found it helpful, I'd really appreciate it if you could just share it with a dentist friend. Copy the link, drop it in your group chat with other dentist buddies, or post it into one of the Facebook communities that you like learning from, because at the end of the day, my mission is to make aligner education as accessible as possible, and I can't do it without your help. And so a simple share would be greatly, greatly appreciated, and I really want to just say thank you for your support. So back to it. This is my favorite phrase to use. It's called polishing. Okay, you're polishing between the teeth. And why is this a good phrase? Because it's a softer, more positive way to describe the process of removing enamel. Okay, I'm not gonna say you're not removing enamel, you are, all right? There is some, like I said, it's very minimal, but it's polishing, okay? You're polishing between the teeth. It sounds non-invasive. It even sounds kind of beneficial. It's like, yeah, like your teeth are all crowded here. I'm just gonna polish between them. I'm gonna make a little bit of space and polish between them, all right? Another phrase you can also talk about, you say painless. Yeah, this is a painless procedure, right? And it just assures them that there's not gonna be any discomfort, and it just helps reduce the anxiety, all right? And then this phrase is good to use when you're just trying to give a little bit more reasoning behind it. So you can tell the patient, like, look, your teeth, they are too tight, and I gotta polish between them with this smoothing device. That's pretty easy to say, right? So this phrase addresses the patient's concern by explaining why is IPR needed in very simple terms, because they're too tight, tells them that you're polishing it, so that way, again, it sounds less invasive, and then you're using a smoothing device. So it just hits all the boxes. A very comprehensive way to talk about IPR. Sounds way better than, hey, I'm gonna shave between your teeth so that way we can fix this problem, right? See the difference there? Anyways, if you found this video valuable, I made another one and we actually go deeper into these aligner concepts. If you wanna check it out, it's right here. I'll see you in there.